prescriptions and non-prescriptions. The client is taking okay medications को बारे में भन्नु पर्यो client यसको policies गर्नु पर्यो मोबी client को accessibility mobility हेर्नु पर्यो changes हुन्छ त्यो that there are few changes that occur in older clients that increase the risk of accidents. Mostly मा चाहिँ strength and function of muscles decrease हुन्छ strength and function of muscles decrease हुन्छ joints become less mobile bones become brittle postural changes and leanness to range of motion occur strength and function of muscles decrease joints become less mobile and bones become brittle postural changes and leanness to range of motion occur strength and function of muscles decrease joints become less mobile and bones become brittle postural changes and leanness to range of motion occur strength and function of muscles decrease joints become less mobile and bones become brittle postural changes and leanness to range of motion occur nervous system changes voluntary and autonomic reflexes become slower decreased ability to respond to multiple stimuli occurs decreased sensitivity to touch occurs decreased vision and lens accommodation and cataracts develop into visions and lens accommodation and cataracts develop delayed transition of hot and cold impulses occurs delayed transmission of hot and cold impulses occurs sensory changes musculoskeletal changes neurological systems changes हुन्छ जेनाइटिभ measures to prevent falls. Assess the client's risk for falling with agency for the risk assessment. Okay, client agency को जुन fall risk assessment हुन्छ त्यसलाई and it is risk of falling for room near the horses station. Preventing measures to high risk room near the risk for and the client that risk of falling for room near the horses station. Reach preventing measures to high risk clients. Preventing measures alert all nurses to the client's risk for falling. Alert procedures and methods are necessary. Alert all personnel to the client's risk for falling agency for the risk alert procedures and methods are necessary. For risk alert procedures and methods are necessary. Assist the client to physical surroundings. Instruct the client to seek assistance when waiting for. Use the nurse call system. Use safety devices. Safety devices राख्ने fall assessment risk assessment skills गरेर assess गर्ने for to near the nurses station को नजिकै लाग्ने nurses station को near the nurses station. Reach preventive measures to high risk clients. Alert all personnel to the client's risk for falling. Use agency for risk alert procedures and methods as necessary. Assist the client frequently. Orient the client to physical surroundings. Instruct the client to seek assistance when getting up. Through the use of the nurse call system. Use safety devices such as foot pads and bed or chair alarms. These devices alert healthcare personnel of the person getting out of the bed or chair. Keep the bed in a low position with the side rails adjusted to a safe position. Bed in the low position with the side rails adjusted to a safe position. Lock all the beds with chairs and stations. Clients' personal items within their reach. Eliminate clutter and obstacles in the lounge. Provide adequate lighting and avoid slippery surfaces. Reduce bathroom overflow. Maintain the client's ratings throughout the day. Instruct the client on the importance of functional shoes with a stable shoes and leggings. Okay, shoes पनि राम्रो हुनुपर्छ. क्लाइन्ट्स टोइलेटिङ स्केल बनाएको हुनुपर्छ. बाथरुममा जाँच मिनिमाइज गरेको हुनुपर्छ. क्लाइन्टको रिस्क एसेसमेन्ट स्केलबाट हाल्छलाई चाहिँ रिस्क थाहा पाएको हुनुपर्यो. जुन क्लाइन्ट रिस्क हुन्छ फल गर्ने कुरामा त्यो क्लाइन्टलाई चाहिँ नजिकै राख्नु पर्यो नियर टु द नर्सेस स्टेसन. टिच प्रिभेन्टिभ मेजर्स टु द हाई रिस्क क्लाइन्ट्सलाई चाहिँ प्रिभेन्टिभ मेजर्सहरू सिकाउनु पर्यो. द क्लाइन्ट्स रिस्क फर फलिङ इज एजेन्सी फल रिस्क अलर्ट प्रोसिडर्स एन्ड मेथड्स आर नेसेसरी. Assess the client frequently. Orient the client to physical surroundings. Assess the clients frequently. Orient the clients to physical surroundings. Instruct the client to seek assistance when getting up. Explain the use of the nurse call system. Use safety devices as floor pads and bed or chair alarms. These devices alert healthcare personnel to bed or chair. Keep the bed in a low position with side rails adjusted to safe position. Lock all beds with chairs and stretchers. Keep clients' personal items within their reach. Eliminate clutter and obstacles in the client's room. Provide adequate lighting and avoid slippery surfaces. Reduce parking plus limit the client's range and schedule throughout the day. Instruct the client on the importance of functional shoes with the stable soles and heels. Importance of functional shoes with the stable soles and heels. This is to prevent falls. This is from a safety and medication for the client. Gate belt may be used to keep the center of gravity midline. Belt on the client prior to ammunition. Belt on the client prior to ammunition. Circle so he only. The client's face to the belt. Circle the client's face to the belt. Hold onto both sides of the back of the belt so that the client does not need to one side. Hold onto both sides and back of the belt so that the client does not need to one side. Be sure the belt is snug. Just enough room to get. Just enough room to get a fingers on the return the client to bed and make sure if the client develops it. Return the client to bed or make sure if the client develops on the street. When finished safely, removing the bed, remove bed and replace it in its appropriate storage area. Goals to establish the safety that ensures the highest preferred to the following self-contained information on these goals. Steps to prevent injury to the healthcare worker. 14.3. Use available safety equipment. Keep the weight to be lifted as close to the body as possible. Bend at the knees. Tighten abdominal muscles and top the pelvis. Tighten abdominal muscles and top the pelvis. Timing the trunk here and knees bent so that multiple muscles work within the body. Maintain the trunk erect and knees bent so that multiple muscles work together in a coordinated manner. Safety equipment are used. So I need safety equipment. Safety or the posture safety equipment. Or we say bend at knees are bent करने आणि सीधे bend the knees protective devices used to limit the physical activity of the client or to immobilize the client on an extremity. Sideways agency policies will be checked and followed when using sideways. Agency policies will be checked and followed while using sideways. Use of side rails is not considered a restriction when they are used to prevent a severity line of sideways. Use is not considered a restriction when they are used to prevent a severity line of sideways. Not considered a restraint, not a restraint when they are used to prevent a severity line from falling out of bed depending on state and agency. The client must be able to exit the bed easily in case of an emergency using sideways. Only the top two sideways should be used. The bed must be kept in the lowest position. The bed must be kept in the lowest position. Physical restraints restrict line movement through the application of a device. Restrict line movement through the application of a device. Clinical restraints are medications given to inhibit a specific behavior or movement. Intervention. See clinical judgment prioritize alternative devices such as pressure-sensitive beds or chair pads with alarms or other types of beds or bed alarms whenever possible. Use alternative devices such as pressure-sensitive beds or chair pads with alarms or other types of bed or chair alarms whenever possible. Use alternative devices such as pressure-sensitive beds or chair pads with alarms or other types of beds or chair alarms whenever possible. Okay. Then this is the primary healthcare. PLCP's prescription should state the type of restraint. Identify specific time limits for this restraint that will be done by limited time frame for use. Okay. Restraints दिन भरिको लागि हुँदैन. Every 1 hour check गर्नुपर्छ in child र every 2 hours check गर्नुपर्छ in adult. Vital signs every 2 hours दिनुपर्छ भने in adult चाहिँ every 4 hours दिनुपर्छ र every त्यो बिचमा चाहिँ restraint open गरेर राख्नुपर्छ. यदि बेडमा साइड रन्स लागेको छ भने यदि सेडेटेड क्लाइन्ट छ भने that is not a restraint, it is a protective measure. साइड इफेक्ट पेसेन्टको लागि. तर यदि छैन भने चाहिँ त्यो रिस्ट्रेन्ट यदि पेसेन्टलाई चाहिँ त्यस्तो छैन बच्चा हो भने चाहिँ त्यो रिस्ट्रेन्ट भयो होइन. फिजिकल टाइप्स अफ रिस्ट्रेन्ट्स फिजिकल केमिकल रिस्ट्रेन्ट्स. फिजिकल रिस्ट्रेन्ट्स द एप्लिकेसन अफ a device medication given to enable a specific behavior of based on not present at the time the restrictions are placed against people who are not present at the time the restrictions are placed within an hour of every 1 डेमा रिन्यू गर्नुपर्छ. त्यो रिराइट गर्नुपर्छ क्या प्रेसक्रिप्सन. पहिलाको एक दिन अगाडिको प्रेसक्रिप्सन चाहिँ चल्दैन. त्यही भएर सम्झो त साइकेट्रिक वार्डमा एभ्री डे मेडिकेसन्स लेख्थ्यो नि त. द्याट्स द नट प्रिस्क्राइब. Not prescribed the restraints or not prescribed PRN. The reason for the sacrifice should be given to the line of reason for the given to the line of the family. Their permission or the permission or the stop and documented. Reason for the permission sought and documented. Reason for the sacrifice. Reason पनि लेखिन्छ र साइन पनि लेखिन्छ. ओके. Recommendation points for the use of a safety device. Safety device, method of use of safe reason, method of use, date and time of application, duration of use and time response, line response. Release from safety devices to unique exercise of operation, neurovascular and skin suspension of continued need for non-continued prevention science response. Duration of the date and time. Duration कति ड्युरेसनको लागि हुन्छ. त्यसपछि बिचमा एसेसमेन्ट क्लाइन्ट्स रेस्पोन्स हेर्नुहुन्छ. Neurovascular anesthesia. Circulatory, neurovascular anesthesia. Continue alternatives to withstand. What can be done in alternative use? Client and family orientation to client and family orientation to environment. क्लाइन्टलाई त्यो फल्स हुन्छ रिस्क हुन्छ भनेर त हामीले डिस्टेन्स लगाएको हो नि त. त्यही भएर क्लाइन्ट र फ्यामिलीलाई ओरिएन्टेसन दियो भने त ओरिएन्टेसन टु इन्भाइरोमेन्ट गर्ने भने त नचाहिएला कम्पेनियनसिप सुपरभिजन ट्रेन्ड सेटर्स डाइभर्जन विथ एक्टिभिटिज एज होल्डिङ टावर असाइन टु रुम near nurses station, de-escalation and verbal intervention for vibration, visual and auditory stimulation, block use of stress and gown, cover intravenous, block use of stairs, dress in gown, block use of stairs, dress in gown, cover intravenous, extra techniques to promote sleep, exercise and evolution, status plan for quality, nutrition and pain management, and discontinue for the as soon as possible. Client and family orientation in a companionship client and family orientation दिन पर्यो. companionship supervision reference details हुनु पर्यो. diversion with activities such as holding towers, diversion with activities such as holding towers, assigning to room near nurses station, de-escalation and verbal intervention for aggression, visual and auditory stimuli, block use of stairs, dress in gown. Okay, de-escalation symptoms are what I think पर्यो. and त्यसपछि visual and auditory stimuli हुनु पर्यो. visual and auditory stimuli हुनु पर्यो. block use of stairs, dress in gown, cover intravenous lines, relaxation, techniques to promote sleep, exercise and evolution, schedules, plan for quality nutrition and pain management, plan for quality nutrition and pain management, discontinue bothersome treatments as soon as possible. bothersome treatments as soon as possible. Discontinue 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 bothersome treatments as soon as discontinue bothersome treatments as soon as possible. Okay, this restaurant must not interfere with any treatments or affect the client's health. With a half a bow or safety knot, the quick release or the quick release offered because the leads in not to movable part of the including the half a bow or safety knot. The quick release offered secondly must be not to a movable part of the that there is enough slack on the straps to allow some movements of body part. This is side warning and possible. The room located near the north is for addition to the following better share alarm activity, comfortable and safe position. Personal being which clean control visual and auditory stimuli appropriate. Visual and auditory stimuli like appropriate. To editing routine established. To editing routine and established one exercise and repetition school room non-split socks are good when banned free of not driving support person. भनेको सेफ्टी एन्ड फल प्रिभेन्सन चाहिँ हुनु पऱ्यो. के छ त फ्युज चाहिँ सेफ्टी एन्ड फलको लागि रेलिङ्सहरू हुनु पऱ्यो, प्रिभेन्सन गर्ने हुनु पऱ्यो. रूम लोकेटेड रूम चाहिँ नजिकै नर्थ स्टेसनको नजिकै हुनु पऱ्यो. ओरिएन्टेसन टु बी प्रोभाइडेड टु द अबाउट द सराउन्डिङ्स अफ द रूम. बेटर सेयर अलार्म एक्टिभेटेड पोजिसन हुनु पऱ्यो. अनि त्यसपछि डिस्ट्र्याक्टिभ एक्टिभिटिज गर्न सक्छ भने त्यो पनि गर्न सक्यो. पर्सनल विदाउट युजिङ पेनले गर्दाखेरि भएको हो भने पेनलाई कन्ट्रोल गर्न सक्नु पऱ्यो. भिजुअल एन्ड अडिटरी स्टिमुलाई सुड बी एप्रोप्रिएट. टोइलेटिङ रुटिन स्ट्याब्लिस एक्सर्साइज एन्ड non-skid socks or footwear environment free of clutter and tripping hazards must all system needed. Support persons present when possible. Alternatives to safety devices for the client is one. Bring the client and family to the surroundings with every interaction. Bring the client and family to the surroundings with every interaction. Identify the client and all processes to the client and family. Encourage family and friends to stay with the client and use sitters for clients who need supervision. Encourage family and friends to stay with the client and use sitters for clients who need supervision. Assign confused and disoriented students needs. Provide appropriate visual and auditory stimulants such as night light, locks, and brushing behavior to the client. Keep the client from using door open. Best family lighting with family pictures and devices and maintain quality indication. Eliminate WhatsApp messages as many as the necessary settings as soon as possible. And all medications are the client is receiving. Use relaxation techniques with the client. Substitute exercise and meditation status as the client's condition is up. Collaborate with the principal. Evaluate the supervision ओके मैले बुझेँ कि सिम्पल कुराहरू छ, ओरिएन्टेसन दिने भन्यो, ओरिएन्टेसन दिने अनि सेफ्टी हजार्ड्सको बारेमा भन्ने, फल प्रिभेन्सन टेक्निक्सहरू अपनाउने, त्यसपछि आफूले फ्यामिली राख्ने बिलोङ्गिङ्सहरू चाहिँ राख्न पऱ्यो अनि क्लाइन्टको निड्सलाई एसेस गरेर त्यसलाई चाहिँ फुलफिल गर्ने सक्ने हुनु पऱ्यो अनि पिएचसिबीसँग चाहिँ रेगुलरली इभ्यालुएट गर्ने, जुन बोथ आर सम पेनफुल प्रोसिडर्सहरूले चाहिँ सक्दो एलिमिनेट गर्ने, किनकि पेसेन्ट होस्टमा आउने बित्तिकै के हुन्छ अलिकति चेन्ज हुन थाल्छ। Poison is any substance that impairs health or destroys life when ingested, inhaled, or otherwise absorbed by the body. Poison is any substance that impairs health or destroys life when ingested, inhaled, or otherwise absorbed. Specific antidotes and only for some types of poison. Antidotes and what we should do for the poison impures the respiratory, circulatory system, nervous system, impacting gastrointestinal and renal systems of the body. Infant, toddler, preschooler, and young school age child must be protected from accidental poisoning. Infant, toddler, preschooler, and young school age child must be protected from accidental poisoning. अब आफै पोइजन खाने र एक्सिडेन्टल पोइजनिङ डिफ्रेन्ट कुरा। इन्फेन्ट, टोडलर, प्रिस्कुलर एन्ड यङ स्कुल एज चाइल्ड मस्ट बी protected from accidental poisoning. Older as immunocytes and older adultsमा पनि हुनसक्छ immunocytes pneumonia may result in accidental ingestion of poisonous substances or an overdose of prescribed prescription. Older adultsमा चाहिँ के कारणले हुनसक्छ त भन्दाखेरि immunocytes अथवा इम्पेयर्ड हुन्छ। सेतो डब्बामा छ भनेर राखेको है, सेतो डब्बामा झोलाउँछ दिनुलाई फिनाइल पनि लाग्छ। पेसेन्ट मे गेट कन्फ्युज होइन, पुवर मेमोरी अनि त्यसपछि ब्लड भएको आइसाइड इम्युनिसाइडले गर्दाखेरि एक्सिडेन्टल ingestion of poisonous substances or overdose of prescribed medication. Poison control center obvious naturals oral mamiko sama-sama terjadi. Vomiting induced vomiting in case of light, petroleum poisoning, vomiting induced भइहाल्यो भने किनकि the other way goes down, vomiting induced गरिहाल्यो भने save the vomiters अनि के मटेरियल थाहा त्यो मटेरियल चाहिँ पोइजन सब्सटेन्स चाहिँ राख्ने सब्सटेन्सलाई चाहिँ bring back गर्ने and back गर्ने unconscious victim called first poison control center practice standard precautions with all clients. Must practice standard precautions with all clients. Regardless of the diet, including hand washings before and after secretions and excretion or intact skin and mucus membranes. These precautions apply to blood, all body fluids, whether normal. Standard precautions से सबै खाला जान्छ. अब यो कस्तो राम्रो भयो. Okay guys, nurses must practice all clients in any setting. All clients with any setting, in any setting. With all clients in any setting, regardless of the diagnosis, effectiveness. Practice regardless of the diagnosis of effectiveness. Standard precautions. Despite of any infections, सबै हेल्थ पर्सनले फलो गर्नुपर्ने चाहिँ प्रिकसन्स के हुन्छ, द्याट इज स्ट्यान्डर्ड प्रिकसन्स. Interventions. Wash hands before, between client contacts, after contact with the blood, body fluids, secretions and excretion of contact with tissues or contaminated articles and immediately after removing gloves. Wash hands between client contacts, after contact with blood, body fluids, secretions or excretion of contact with tissues after contact with tissues or contaminated articles and immediately after removing gloves. Between client contacts, after contact with the body fluids. Wash hands between client contacts, after contact with the body fluids and secretions and excretion or intact skin or mucus membranes, after contact with the wait after removing wash between client contacts, after contact with the body fluids, secretions and excretion or intact skin, mucous membranes, after contact with the equipment or contaminated articles and immediately after removing gloves. Okay, between कति बेला अरे त between client contacts, body fluids, secretion, bodily fluids सबैसँग पाउँछ. bodily fluids, even mucous membranes कता हुन्छ त्यतातिर आउने गलाइमा आउँछ, एनिसमा आउने भयो, ओरल म्युकस आउने भयो, नेजल म्युकस आउने भयो, आँखाको भयो, इयरमा हुन्छ, सबैतिर हुन्छ नि. आफ्टर कन्ट्याक्ट विथ म्युकस मेम्ब्रेन्स पछि चाहिँ गर्न पर्यो. नन इन्ट्याक्ट स्किनको टचमा आइसकेको यति भयो ओके होइन. Standard precautions for protocol. When not touching it, कति बेला wash hands, कति बेला wear gloves, कति बेला when touching blood, body fluids, secretions, excretion, use hand sanitizer, for routine decontamination of hands, use alcohol based hand sanitizer, routine decontamination of hands, decontamination, use alcohol based hand gloves, use alcohol based hand gloves, convert information with mask and eye protection on face, hands, a mask र eye protection कति बेला हुन्छ, face use mask and eye protection on face shields, use mask and eye protection on face shields if client care activities may splashes or strays on blood or body fluid. Mask and eye protection on face shields if client care activities may splashes or strays on blood or body fluid. Gowns if swelling of the anxiety from body or body fluid, mask and after removing stays for toning and असर लगाउँदैन नेटमा लगाउँ अनि कसरी राख्नु काउन्टिङ गर्दाखेरि सुरुमा नेट आउने वेस्टमा then it was fasting at me then it waste and fasting at me then it waste. This is already using a pairing motion and waste and is pulling down from each shoulder to waist the hands, pulling down from each shoulder to waist around forward and as well as secure tiger fasting hands laying the yawn and the certificate is an activity we to move the is the activity which you follow the voice that's what you type on top type should you bottom type this is all the top types so money as it repeated from the device these devices are China level safety control. The accident was contaminated linen in a leak-proof contaminated linen size and leak-proof bags through container scarred all sharp instruments and needles in the puncture-resistant container. Scarred all sharp instruments and needles in a puncture-resistant container. Dispose of needles on camera in this technique and the needle clean spills of body or body fluids with the solution of bleach and water. Disease and water bleach 1:2 water को रेशियोमा हालेर चाहिँ मिक्स गरेर क्लिनिङ गरेर फ्याल्नुपर्छ। Carrier protection under negative pressure. Do a reverse force negative air pressure minimum of 6 to 12 air excesses per hour via HEPA filtration mass or according to agency protocol. Here the one देखिए negative air pressure so 6 to 12 your exchanges via HEPA filters go through water particles or according to agency ultraviolet radiation so radiation HEPA filter is used this radiation और HEPA filter क्यों क्या अपन रूमात हो यार HEPA filter बहुत एक दबाते ओटी को ये रूमात है नहीं यार filter ड्रॉपलेट प्रिकॉशन मध्ये के टायर प्रोटेक्शन गरेको त भन्नु ड्रॉपलेट प्रोटेक्शन प्रिकॉशन्समा चाहिँ के हुँदो रहेछ त भन्दाखेरि 3 feet क्लाइन्टकोमा हुँदाखेरि सर्जिकल मास्क युज ओके सर्जिकल मास्क युज ओके तर यदि अर्को COVID-19 को लागि चाहिँ what do we have to do चाहिँ we have COVID-19 को लागि earbone खतरा रहेछ ड्रपलेटको लागि त मास्क लगाएको हुन्छ है के रहेछ earbone को भ्यारिसेला जोस्टर अनि चिकन पक्स मिजल्स सार्स को COVID-19 अनि अर्को चाहिँ pulmonary imbalances मतलब त्यो खतरा हो contact precautions is colonization of infections with the multi-drug resistance organism. Colonization by infection, the multi-drug resistant enteric infection for the post-stadium enteric infection for the post-stadium multi-drug resistant organism. के इन्फेक्सन स्किन इन्फेक्सन हुन्छ नि स्किनको थ्रुबाट के हुन्छ त्यही डायरिया भयो मिजल्स भयो त्यो तिनीहरू क्लस्ट्रिडियम डिफिकल्टको इन्फेक्सन भयो त्यसपछि इन्टेरिक इन्फेक्सन त्यो भयो अनि कोलोनाइजेसन इन्फेक्सन मल्टी ड्रग रेजिस्टेन्ट अर्गानिजम छ भने रेस्पिरेटरी इन्फेक्सन्समा फ्लू भाइरस इन्फ्लुएन्जा भाइरस चाहिँ सर्च भयो यसरी स्किन इन्फेक्सन्स आई इन्फेक्सन्स कन्जक्टिभाइटिस एडिनो भाइरस इन्डाइरेक्ट कन्टेक्स इमर्जेन्सी रेस्पोन्स प्लान डिजास्टर इभन यो पनि डिजास्टर म्यानेजमेन्टमा पऱ्यो COVID-19 को सर्च भएर आए पेसेन्टहरू भने द्याट इज अल्सो द्याट वुड अल्सो बी कोभिड के भन्छ इमर्जेन्सी रेस्पोन्स डिजास्टरमा पर्नु ओके बायोलोजिकल वारफेयर एजेन्ट्स अर्को एजेन्ट्स respiratory system, gastrointestinal system, अनि अर्को चाहिँ mucous membrane through transmit हुन्छ what if anthrax what is anthrax direct contact lungs म एकैछिनमा गएँ पढेर 5 मिनटमा फ्ल्याच भनेको एउटा के रहेछ त केले गर्दाखेरि ब्यासिलस एन्थ्रेसिस भन्ने उसको ब्याक्टेरियाबाट गर्ने इन्फेक्सन बाई डाइरेक्ट कन्ट्याक्ट डोर्मेन्ट द्याट बिकम्स एक्टिभ विथ द एन्टर लिभिङ होस्ट ब्यासिलस एन्थ्रासिस भन्ने ब्याक्टेरियाले गर्दाखेरि हुँदो रहेछ डाइजेस्टिभ सिस्टम्स एब्रेजन्स इन द स्किन्स अनि इन्फेक्सन थ्रु द लङ्स ट्रान्समिटेड बाई डाइरेक्ट कन्ट्याक्ट विथ ब्याक्टेरिया एन्ड स्पोर्स डाइरेक्ट कन्ट्याक्ट विथ ब्याक्टेरिया एन्ड स्पोर्सको थ्रुबाट ब्याक्टेरिया र स्पोर्सको थ्रुबाट spores are dormant encapsulated bacteria that becomes active when they enter a living host. No person to person spread. Patients carry to the lymph nodes and then spread to the rest of the body by way of the blood and lymph system. High level of toxins lead to shock and death in the lungs. Anthrax can cause build-up of tissue decay and death if untreated. A blood test is available to detect anthrax. Tests and antibiotics bacillus anthracis. Blood test in the lung. सक्यो लागिरहेको छ सकेन
तपाईँको छ कि पालो बिजुलीको कुपन लिएर गएको टाइम लाग्छ बस्दै गर्दै गर्दै टाइम त के यतिखेर भयो फेरि बिजुली जोड्दै के लाग्नु पर्यो